Congratulations!
You are preparing to study abroad. Deciding to study abroad is a great opportunity to learn in a different country and increase your knowledge of the world.
You are going to see and discover many new things and meet new people. Studying abroad allows you to explore new cultures, enhance your UC studies, and get international experience, which are all important in today's global job market.
Studying abroad can be an amazing and life-changing experience, but it can be challenging in a very personal way.
Being in a new place and encountering a different culture can be overwhelming for some students.
I traveled abroad last summer. I was so excited, but a little anxious because I didn't know what to expect. I assumed certain things would be different. I knew to expect different language, food, and weather. I made sure to learn a few phrases in the country's language and how to exchange my dollars to local currency. But here's the thing. Most people don't really make plans for their mental health. When I went abroad, I found out I was not prepared for how it would affect me on a deeper level. When I first arrived, things were going well. I was having a lot of fun and was really enjoying my class. But after the first 2 weeks, I really started missing my family and friends back home. I realized that they were just a phone call away, but I still felt like I was missing out. I found myself always wondering what they were doing. My fellow students would invite me to go with them to explore the city, but I didn't want to. I would stay in, sleep, eat, and I was always on Facebook and Instagram. I was starting to regret my decision to study abroad. I was spending an excessive amount of time every day talking on the phone and on Skype with people back home instead of enjoying myself. I was withdrawing from others and feeling sad and lonely almost every day. My family would ask about the cool things I was doing, but I had nothing to tell them because I was only going to class and staying in my room. My parents were concerned. I thought I was just homesick, but my parents thought that it was more than that. They told me about a pamphlet my campus provided with information on signs of depression. I must have skipped over that brochure in my excitement to leave. I really identified with some of the symptoms listed in the brochure and agreed I should probably get some professional help. But because I hadn't read the pre-departure information on accessing counseling services abroad, I didn't know how to get help, and I felt too tired to reach out. I just wanted to sleep. Thankfully, I remembered that during my program orientation, the topic of health had been addressed. So I called the local UC representative who told me where to go and what to do. After a couple of weeks of seeing someone, my symptoms started to diminish. I started spending more time with local friends and less time sleeping and on social media, which also made me feel better. It didn't happen overnight, but I eventually started to shake my symptoms and enjoy myself.
During my time studying abroad, I was spending a lot of time with friends, meeting new people and doing a lot of new things in the area. We studied hard, and on our downtime, we toured the surrounding areas and visited major landmarks. We went dancing, shopping, and we talked with the locals. Every day was a new adventure, and there was just so much to do. We really enjoyed visiting the different restaurants and trying new food. Everything was going well until I had realized that there was something I had not adequately prepared for. You see, back home, I had been struggling with an eating disorder for almost a year. It had gotten so severe that at one point, I was in the hospital for a week. In the States, I had been seeing a therapist. With time and her help, I had got to a point where I was able to accept myself, better manage my life, and was considered stable on my condition a month before leaving to study abroad. After a few weeks of being in my new country, I realized I had gained some weight and immediately felt out of control. I did not expect this. Was I falling back to an eating disorder behavior? I never thought that I would struggle with a relapse while traveling abroad. I kind of thought that going to a new country would be a vacation from everything, that somehow I wouldn't face the same issues that I dealt with at home. I found out that not only will your problems come with you, but they may be intensified by being out of your comfort zone. I was confronted with so many new things that I no longer had the routine I had back home. I wish that I had been more prepared and spoken to my therapist about potential triggers and what it meant to continue with a sustained recovery. I wish I had done this before I left, because if I had prepared a careful plan before traveling abroad, I could have been able to identify triggers, work on effective and healthy coping skills, and reach out for help. Being in an unfamiliar place affects people in many different ways. Even the most seasoned travelers can struggle with the transition. Everyone can benefit from having a mental health plan.
I was totally ready to study abroad. I had my passport, I planned my classes with my academic counselor, I had my student visa, I had a basic understanding of the language, I thought of everything. But then again, I'm always thinking of everything. My mind is always racing. I think of everything that could possibly happen. Sometimes it causes me to have a lot of anxiety, but I've learned to manage it with prescription medication. It's difficult to function without it, and I never thought I would have to in a foreign country. About a week after I arrived, I realized that I was out of medication. I wasn't worried though. I would just find a pharmacy and get my prescription refilled, right? When the pharmacist told me my medication was illegal, I was completely shocked. A doctor in the US had prescribed it to me. Why would it be illegal there? I had no idea. I didn't know what I was supposed to do. I spent the next few days on the phone with my doctor, the program director, my insurance provider. It was time-consuming and terrible. My classmates were enjoying their first week abroad, and I was just trying to keep it together and figure out what to do. When I finally was prescribed a new medication available in that country, I started feeling like myself again. If you're studying abroad, you've really got to be prepared. You may think you're not forgetting anything, but it's better to be safe than sorry. Take it from me. I did my research and I thought I was prepared, but the one thing I forgot to do was read my pre-departure materials and use my UC resources. Take advantage of your resources and work with your doctor on a mental health plan before departure.
It is helpful to be aware of the common issues that can manifest abroad and the symptoms so that you can understand what is happening to you or your friends and can take steps to counteract them. Homesickness, culture shock, and stress are all common and expected when adjusting to a new culture. Culture shock is caused by differences in things such as communication, worldviews, values, different academic culture, transportation, and many others. Symptoms of culture shock include sadness, difficulty studying or working, frequent crying, nervousness, irritability, and withdrawal. Adjusting to a new culture can complicate any pre-existing issues you may have been managing well at home. Many students feel that traveling will help them leave the problems behind, but the opposite is true. When you pack your bags, your problems not only come with you, but can be intensified by the stress that comes with adjusting to a different culture. It is important to maintain a healthy well-being and balance, and remain flexible about differences. Talk to your doctor before departure. Develop a mental health plan and know how to reach out for help if needed. Identify how you will access support abroad. Investigate mental health services in your destination country. If you are currently taking prescription medication, find out whether it's available and legal in your destination country and get information about traveling with medications.
Self-care is easy. Remember, keep in touch with family and friends or anyone else you consider your support system. Also, make sure to get enough rest.
Eat well-balanced meals and make sure to exercise.
Keep a journal. Familiarize yourself with the area, culture, and customs before you go.
You should arrive abroad with an open mind, and most importantly, be patient with yourself.
Traveling abroad was one of the greatest experiences of my life. I had a great time and grew as a person.
To successfully study abroad, you want to physically and mentally feel your best. Remember, it takes time to adjust, even for the most experienced travelers.
My homesickness only lasted for a short time, but if you experience these symptoms for longer than 2 to 3 weeks, or it begins to impact your school, work, or family, seek help. Access your UC resources.
Your experiences will translate into tangible benefits throughout your entire life. Remember, the world is a beautiful place.
So have fun!
Other common struggles while abroad include feelings of isolation, fear, or confusion for LGBTQI students, unexpected pregnancy, contracting a sexually transmitted disease, sexual violence and harassment, alcohol or substance abuse. You can reach out for support for these and other concerns while abroad by contacting your local UC EAP representatives for help to identify confidential counseling and psychological services in your area. For 24-hour confidential support during pre- or post-departure, call 858-534-3755 or visit our website